discovery and then development. So it takes about 15 years, and then we have to spend about $2 billion to produce or generate one novel drug. And then successful ratio, when you look at here, 0.01%, it's very low. So how we can increase this successful ratio, and how we can decrease the time for development, and how we can reduce the cost for this discovery and development. I think there are solutions. The solution is come from the nano formulation and then AI big data. How we can make this? The first one, so you have many candidates molecules, because you are working for the TCM, traditional Chinese medicine. So I was told that you have 10,000 or the million, the library, the molecules and the plant species. How we can develop or discover novel drug from this bunch of the library. So you just put this your candidate in our C. elegans system. So this C. elegans is a model organism to demonstrate how we can develop or discover the novel drugs. And then this small organism can generate the big data. And this big data can be applied for the many kinds of the artificial intelligence AI platform. So and we can determine, or we can evaluate, or we can predict the result of this your candidate. And then there's another way to increase the successful ratio. What is that? Is nano formulation. So you're to extract the plant extract, or the compound isolated from the TCM, is have many hurdles to just directly apply it for the human body or the human digestion system. How we can increase, or how we can improve these delivery issues, so we can formulate the TCM using the nano formulation method. So now I'm going to talk about these two things. So these are the human blood vessels, our circulation system. When you look at these blood vessels, you could find there are transparent the liquid, but but apparently there is nothing. But so in this transparent liquid there is proteins, the many proteins. So a bunch of albumin proteins in the circulation system. So what mechanism behind this circulation system? If you eat drug or taking drug or injecting drug, these drug molecules can bound to the albumin proteins. So these albumin proteins actually carry your the drug and the TCM into our whole body. So there is a kind of binding mechanism between the albumin protein and your drug. So there is some of the binding sites even in the small the albumin protein. So when you look at here, there is a very popular the drugs like the Tylenol or the ibuprofen. So these the drug molecules can bound to this albumin protein in our circulation system, and then these delivered to our whole body. So the many global big pharmas already developed this nano formulation for their global sales drug. For example, the paclitaxel is a representative drug together with this nano formulation. The second generation of paclitaxel is combined with the albumin protein in our human blood vessel circulation system. And the third generation is will be incorporated with the polymeric the molecule. And then this nano drug, nanomedicine has an increased the pharmacokinetic value, and then you can reduce the kind of side effect. And then there are another very popular case is the COVID-19 the vaccine. So Moderna and then Pfizer, they produce the vaccine molecule, the vaccine using this lipid nanoparticle technology. So this nano formulation, or we call it a nanocomplexation, It's kind of natural thing. So we could call this one is a protein corona. So in your body and in your cell, so there is a protein. The protein can bond with the other molecules, the surrounding the molecules. So for example, the protein can bond to the sugar the molecule, or the polysaccharide molecule, or the lipid molecule, or any other metal ions. So they can bind together with this surrounding molecule, because it has a property of the amphiphilic property, and then after this binding, the complexation, the protein surface can be changed. The surface modification increase your drug, the pharmacokinetic value, or your drug delivery. So my student project developed how we can efficiently formulate this nano drug using the small molecules or the plant extract or any other molecules together with the protein. So glabridine is one of the representative small molecule or the extract molecule from the TCM, 감초 maybe, yeah. And then this glabridine can bind to the human serum albumin, and then we made nano complexation, nanomedicine. So this is demonstrate how we are making this nano formulation. The method is very simple, but there are some kind of tricky points. For example, how we can optimize the condition so when they are meeting each together. For example, small molecules can bind to the large size the protein molecule. So there is a kind of tricky point. We optimized this condition with many trial errors, and then we actually found that there is a kind of golden rule how these small molecules are bound with the protein molecule. So this nanocomplexation has a size near the 100 nanometer, and with really good PDI value and the zeta potential. So higher the zeta potential indicates that this nanocomplex molecule, it doesn't aggregate each other. And then we simulated this protein complex using the computer simulation program. So we can predict where this small molecule can bind to the protein, the size. So we tried make this nanocomplexation out of using the many natural the compounds from the oriental herb, and then plant extracts, and then many other the molecular compounds. So for example, this is over-albumin protein can bind to with the glabridine. So one of the the TCM molecules. And then how we can interpretate this binding between the small molecule and the protein. So there is a couple of ways to interpret this one. So the first one is the spectroscopic method. So I mean the former the speakers presented the many kinds of instrumental analysis. We also employed this instrumental analysis to interpret the binding mechanism. So one of them is the fluorescence, the spectroscopy. So when the small molecule binds to the protein, there is the fluorescence amino acid residue in the protein. If the small molecule binds to near this fluorescence amino acid residue, there are two types of the quenching of the fluorescence. So first one is the static quenching, and the other one is dynamic quenching. When this bind is very the strong and rigid, we could find the static quenching from there. This static quenching indicates that this nanocomplex is very stable. So there is a kind of a mathematical interpretation, the formulas like Stern-Böhmer equation. Through this Stern-Böhmer equation interpretation, we can get the kind of coefficient and the kinetic values to explain how this nanocomplexation is stable, and then how many of the small molecules can bind to the protein molecule. So through this mathematical interpretation, we could say this nanocomplexation is really good for the our drug delivery or the final products of our drug. So these are one of the methods, and then this movie takes explain how we can do the computer simulation things. So there is a sound. So I mean this sound will help you away from my presentation. Okay. So there are a bunch of the candidate molecules, and then we can simulate this binding between small molecule and the protein thing. So we can predict how or where this small molecule can bind to the protein molecule, and then we could pick the appropriate or the